Okay, the nice thing about the isolator tool is that it can isolate one head of the gastrocs. Now we can feel right through the tool. There's something that's probably a little bit tender there. Is that tender?
Yeah.
Yeah. And sometimes these two heads will actually get stuck to each other. And of course, this is great because you can actually bring that little prong in between them and get right down in there. Obviously, it would take a little bit of work before I could really get right down to the soleus in between the gastrocs heads. But for the sake of this demonstration, you can see how I'm doing this. So let's go up and check out the hamstrings. The purpose of this tool, the inspiration for this tool, was to be able to isolate certain muscles. So if her hamstring is a little smaller, I can turn it at an angle like this and be able to cover that whole hamstring right through there. On a bigger muscle, if I leave it completely flat like that behind it. But if you turn the tool diagonally here a little bit, you see now it completely conforms to the muscle, and we can get right up into that ischial tuberosity there with that tool. A little tender in there or not?
Okay, yeah.
A little bit. If I bring the tool down like this on someone as opposed to this, you can see that I can get a better surface area if I've got it done at an angle. If I'm on a real curved position, I could have it up a little more vertical. Okay, here in the piriformis, I could use this round, flat tip area. I could also use that one more precisely of the femur. As you know, there are ligaments that come down from the sacrum through this area, and some of them run down the shaft of the bone of the femur, the leg bone, and this tool fits right onto that. It cradles that bone really nicely, so you can get that far better than you can with any other tool. I used to use sometimes the flat edge of the T-bar, but of course you had to make more passes. This one is definitely much more effective. Can you feel that in there?
Yes.
Yeah. And I could use this up in the glutes as well. We can go in here and work this QL with this tip. I would normally use the precious, the round ball part on that lamina groove, but I could sneak in here with this a little bit. It works pretty well. Also, this tip can kind of function a little bit like the ball. If I didn't want to go over and grab the other tool, I could. And now if I set this part of the tool right down on her back of her shoulder, just like that, and if I take my fingers underneath here, and I may sometimes set my hand on this part of the tool, so I'm kind of cupping like this. For the sake of this video, I'm going to have to try to keep my hand away. Now, if I gather all of the trap away like this, and grab it here, I can now work that area. Can you feel that?
Mm-hmm.
Yeah, that's really effective. Now I'm pushing my fingers into this tool, into this edge, and also into this part here. It's really effective. As you probably know, the trap is kind of pup tent shaped. In other words, there's a part coming this way, part coming this way. And those two areas will sometimes grow together. They'll actually stick together. And one of the ways to treat that is to use your thumb and your fingers and to do this sort of a motion. But again, it's really hard on the thumb. You now have something that's stabilizing that trap so it can't get away. Pushing the trap right off of I'm getting a few. I can push. I'm not sure that it isn't even a little bit of the levator.
I think it is.
Yeah. I can, now again, if I was actually doing it, I'd have my palm of my hand on that ball, and I'm kind of going like this, and into there, into there. Now I can also hook this around on this side and do the same thing with the palm, but for the sake of the camera, and sometimes I do it this way, I've pulled the whole trap up off of the other tissues there, and now I can go right in there. Does that feel really effective, Lana?
Yes.
Yeah. A lot more effective than someone just working with their thumbs and fingers, perhaps.
Yes.
And I may show this more when she's face up, but then of course I can get this trap really nicely this way as well. Okay, I will use this part of the tool, deltoid. Okay, and I can do this triceps up through here as well, and of course the biceps. Okay, and we can do these muscles in the arm. And again, if I turn the tool this way, if it's a little narrower muscle, in an actual setting probably with the Precious tool, but if I could briefly work it with the point of that tool. Rhomboids, I can work through that whole area really nicely. In an actual therapeutic setting, I'd have both hands on the tool like this. But so you can see what I'm doing, I'm trying. Okay, one of the other new tools that I've made is this little pillow. It's shaped, the inside is all sealed in plastic, so no bacteria or anything gets into the foam. And then it's just in a little drawstring bag that you can throw in the wash. And I will slip that underneath her head. And that gives me all of this space underneath here where I can work without it. So I was able to turn her head, and the way this little pillow is designed, it will hold her pretty much exactly where I want her. I don't have to be putting my hand on her and holding it in position. It's designed to fit and just hold the person right where you put them. So now this tool will slide along the side of that neck. We can do those transverse processes. This little part of the tip right here, I want to have about in the lamina groove at the furthest back. I don't want them bumping into the spinous processes. And then I can come anterior further as well. I guess you could even press the SCM into that a little bit. So you can see this tool is so effective for right onto the occiput, and I can work these splenius capitis and upper trap insertions right on the skull. Obviously, if I was working in the clinic, I wouldn't be standing over her and holding it quite like this, but you get the point. Can you feel that on that?
Mm-hmm.
Yeah. Feels effective, or?
Yes.
Yeah. And now if I was down in lamina groove, I'd be using the Precious, the ball, but I could also substitute this if I had it in my hand and there was something that I really specifically needed to get. And I'd also use this flat part in the rhomboids here. Work through there. And I could bring this edge right over into the lamina groove there almost if I wanted to get a little. And clearly you could use this over in infraspinatus. Thank you for visiting the Career Extenders website.